Concept 39, Professional Identity. Learning objectives. Define and describe the concept. Recognize attributes of professionalism in the nursing profession. Identify ways that professionalism affects healthcare. Definitions. Professionalism. Assimilation of nursing skills and knowledge integrated with dignity and respect for all human beings. It incorporates the assumptions and values of the profession while maintaining accountability and self-awareness. Attributes of professionalism include research on professional identity formation is underdeveloped. There are contributing theories. Marcia and Josselson note that identity issues first arise in late adolescence when society and adolescents expect beliefs and vision for future career goals will start to form. For the adolescent and growing young adult, this occurs within an environment of exploration and commitment. It is manifested through four identity statuses: identity diffusion, foreclosure, moratorium, and identity achieved. Identity diffusion is characterized by a lack of interest in commitment and even in exploration. The catchphrase for this would be whatever seems good at the moment. The second identity status is foreclosure, in which the person keeps talking about changing those around him or her and conspicuously not about making changes to him or herself. Moratorium is the third identity status, in which overwhelming anxiety occurs that is hard to sit through with someone. The fourth status, identity achieved, means that the person is reasonably self-aware, has a sense of self, and can manage overwhelming anxiety should it occur. Krieger and Godfrey's work with a stair-step model of professional transformation for nursing visually represents the dynamism in professional identity formation. The main ethical traditions are represented in the model on page 381, figure 39.3, along with the transformational nature of nursing, with the reality of slips and progress, which is flourishing, that occur throughout the trajectory of one's career. Finally, the progress toward the ideal is a function of individual and group efforts with influences from many experiences. From an intervention standpoint, Bandura, another theorist, a social learning theorist, in which learning occurs through observation of others, and Meziro's transformational learning theory, in which growth and development are outcomes of transformational learning when sufficient levels of cognitive functioning are present, form part of the theory basis for professional identity and professional identity formation and interventions. Connection between professional identity with nursing and healthcare. Forming and fostering professional identity, interprofessional perspective on professional identity and professional identity formation, and interventions to achieve professional identity formation. The interrelated concepts include clinical judgment, leadership, ethics, and communication. The concept of professional identity is interrelated with these concepts. Clinical judgment depends on a deep and meaningful understanding of the professional identity of the nurse, incorporating health and illness concepts along with the norms and values that characterize the nurse as a designer, manager, and coordinator of care, and as a member of a profession. Principles of leadership and ethics govern the nurse's social contract with patients and families in his or her care, affirming that advocacy for the patient and family is a primary consideration for all decisions made within the healthcare environment. Communication is fundamental to the nursing discipline and as such constitutes a substantial part of what actually happens in moment-to-moment nursing practice. What is the concept of having control over nursing practice or the authority to make decisions related to nursing practice? Is it accountability, autonomy, advocacy, or attributes? The answer is autonomy or control over nursing practice, and it refers to the authority to make decisions related to the nursing practice. A desire to become part of the group is called, is it 1, professional identity, 2, ethical identity, 3, social identity, or 4, personal identity? Your answer should be 3. A desire to become part of the group is apparent even among student nurses as they thrive and strive for recognition. What activities can novice nurses engage in to encourage professional identity formation? 1. Interact with nurses or student nurses only. 2. Mimic behaviors observed in clinical nurses. 3. Question medical students regarding expectations of nurses. Or 4. Engage in reflection activities following clinical encounters. The answer should be 4. Developing professional identity is challenging, but engaging in activities such as listening carefully to expectations, valuing debriefing and feedback from role models, engaging in reflection, actively adopting a professional identity, understanding one's own responsibilities for learning and being accountable for them, building relationships, developing personal self-care habits, and embracing opportunities for experiences with patients facilitates professional identity development. This is the end of the slideshow.